Hi there, Andrew with Zang Physical Therapy here. And today I want to talk a little bit about ankle sprains and why that ankle may still hurt and why it might only get worse. So, chances are, if you've done any kind of sporting activity for a significant period of time, and or people who just like to hike and walk and be active, may have sustained an ankle sprain. So it's a very common injury, and base of the ankle just kind of turns to the outside, and you'll get pain on that outside part of the ankle. Many of these people who sustain this injury, it can be mild, at least that first time, and they can kind of walk it off and they'll be just fine. But what happens is you'll twist that ankle again, and time will go by, and it might happen again. And so while that first and maybe that second one might not impede you that much that you can tell, the more you injure that ankle, the more you sprain it, the more likely it is that you're causing damage to that tendon and that ligament, because ligaments don't have great blood supply like the muscles do. So when they get stretched out, they're not going to shrink back up to the size that they were before. They may shrink up a little bit, they may scar down, they may seem a little bit tighter, but it will never be the same. So one thing that happens with frequent ankle sprains is something we call chronic ankle instability. And I have a good friend who's, I think he might be 31, 32 now, and he's been spraining his ankle since he played soccer when he was a teenager. And this happened in track when we were running together in college, and it continues to happen as an adult. And the interesting thing, his wife is actually a physical therapist, and he's still not getting any better because he's not doing what he needs to do, regardless of what his wife tells him or what I tell him when I go see him. So he's developed this chronic ankle instability, and that is as a result of repeated ankle sprains. And the way to combat this is actually taking the time to get treatment early on and to heal up. Even if you think you are fine, your balance mechanism or proprioception more specifically might not be 100%. This mechanism gets tuned up from the time you learn to walk, but oftentimes as we age, we don't challenge this mechanism, so it may be a little bit reduced sensitivity. And then when you sprain the ankle, it really turns the volume down on the sensitivity. And you just need some training to bring that back up to a level that can help you reduce your risk for frequent injury. So this involves strengthening the ankle joint. It involves doing some joint mobility exercises, because oftentimes after an ankle sprain, things will get a little bit stiff and your body will compensate. And you may or may not be aware of this, but it will be a factor. And the last thing is working on that balance and proprioceptive mechanism. Again, people, within a few days, they tend to walk it off and they seem okay. But in the end, they go out and they play soccer, basketball, they go hiking, they hit a rock, and boom, that happens again very, very quickly. It happens easier and easier. So the way to combat it is to actually give your ankle some TLC, get some treatment. Even if you feel okay, at the very least, go learn what to do so that it doesn't happen again. Because the more frequently it happens, you're going to wake up in the morning and it's going to be sore. Like the gentleman I saw yesterday. He's in his mid to late 20s. He's had 2 ankle sprains in a 6-week period, and now he's hurting. And he knows, hey, I can't afford another ankle sprain because it's going to take me down and out longer. So what is he doing? He's coming to learn what to do to prevent it from happening again and to take away that morning pain, because he gets up every morning and that ankle hurts. And he's just tired of it. And he should be, because again, he's only in his mid to late 20s. So that is not a normal thing. So have an ankle sprain, don't ignore it. Don't think you can just walk it off. Maybe you can when you're 17, but by 34, you're not going to walk it off as easily. If you've had multiple ankle sprains by the time you're 20, even by 30, it's not if, it's when it's going to happen again to you. So take the time now to address any issue that you can so that that ankle doesn't continue to hurt and then it doesn't get worse. If you have any questions, again, put things in the chat bar. As always, send me an email, andrew@zangpt.com. I'm happy to engage you in conversation and help point you in the right direction so that ankle does not continue to be a problem later on down the road, such that you need some doctor to go do surgery on it to retighten. But again, if you have any questions, please let me know. Otherwise, have a nice day.